Hi there, here we are with our patient Eric. Eric stopped by the office today. We did a MaxHarvest procedure on him about 5 years ago. And he's here today just for a stop-by check-in. How's life, my man?
Excellent, couldn't be happier.
Good. And so are you happy with the work we did for you?
Listen, I think I saw the doc. He was like, would you like to do a video? I'd be absolutely happy to do a video, but I think for anybody who was on the fence like I was and you were thinking about doing it, and I'm not trying to sell one way or the other, I did it, changed my life. I'm happier, I run around, I can wear a hat, I don't have to wear a hat, I'm not covering up anything. It's been over almost 5 years now. I couldn't encourage you more to do it, so.
Awesome, I appreciate that. Now, when you were, before the transplant, had you lost your confidence? Was it for today? What was the main reason you came in 5 years ago?
I think anybody who's watching this video probably had the same thing I was. It was either you're taking over the counter, you're taking vitamins, you're probably rubbing chili on your head, you're trying to figure out what it is that'll stop. You're tired of washing your hands and watching hair fall out everywhere. That was me. And it is like you see a lot of folks that suffer from it, and it's real, right? It does take an emotional strain on you. So I would say do it. It's more common than ever to actually assess these things now and do something about it. And today, there's someone here that can help you fix it. I couldn't encourage you anymore.
Awesome. Okay, so what we did when we did this procedure 5 years ago is we went through, we reframed the face with the nice, soft, one-hair grafts all the way around. He kind of had these higher recessions on both sides, so when you look at him from the profile, this used to go way high up here, and we just completely reframed his face for him. Came out super soft and natural. Other side, same situation, just completely reframed it. So when you look at him from the profile, you'll see how this is kind of a straight line versus if you look at the befores, it was way up there. He just had his hair cut, so he's got a little bit of a kind of a colic back here. But anyways, kind of lean your head back. Yep, so we did a nice big density case back here as well, one pass. He's probably 100% bald now if he didn't do that surgery. But this is what that looks like 5 years later. And had he not had the procedure, I think he'd be in real big trouble. He's a great patient, he's following his instructions, he's on the Propecia, which is something we always recommend. And the suture line, so I'm going to show that off while we got you here. When we do the big case, we take them all the way around from over here. Josh, if you want to come in just a little closer, you might be able to see that a little better. It's just kind of running through there like that. It's literally perfect. You can barely even freaking see that. And that's 5 years ago. So think about how much better I must have gotten those 5 years. Chin down just a little bit for you, please, Eric. Thanks. Just awesome, man. It's like a tiny, tiny, tiny little line. It's just beautiful. Did you ever see that? It's perfect.
How funny is it that that's 5 years ago? Most doctors that we compete against every day haven't even been doing this 5 years.
Correct. That's the truth, man. That's the truth.
That's our new competition.
I've been doing this over 20 years. 20 years. Anyways, I really appreciate you doing the video. It came out freaking awesome, man. Congratulations.
Can't thank you enough.
One last thing for all the guys watching at home saying that's a big deal. That's a 23-year-old kid. He's 38, so.
That's right, 38.
All the
Proud of it.
skeptics, big deal. That's a 23-year-old. Now he's 38, so that hair, it helps.